If you got pain from this general area right here, but you don't quite know where it's coming from, it could be your lower back, it could be your pelvis or SI joint, it could be your hip. This is problematic because now you don't know where it's coming from, you can't do anything about it. So I want you to stay tuned. I'm going to go some good information about the low back, the SI joint, and the hip, where it may be coming from, and what you can do about it. Take a quick second here to subscribe, and don't forget to hit the bell, because then each week when we put out a video, you'll be notified about videos we put out about balancing your body, getting strong, getting mobile, also that you can live a life of your choosing. I'm Kim So. I'm the owner of SolCore Fitness, and I've been in the health and fitness field for over 25 years. I'm a summer therapist and a summer trainer. It's kind of like a physical therapist. But I've been imparting this information I've given to you in these videos through hundreds of my clients and help them get back to the life they want to live, to get them more mobile, to get out of pain, better posture, more aware of their body. But the more important thing is they're now more empowered. I want to share this information so you can become empowered, so you can also live the life of your choosing. Knowing where your pain is coming from is a big part of assessing where your issue's at. It's not the only way. You want to do a complete intake too. You want to assess your whole being. You want your structure, your lifestyle factors, your diet, your hydration, your medical history, all to get an idea of the etiology, where the issue might be coming from, not just where the pain is at. But that would take way too long. It's going to be enough information as it is. So we're going to focus on just the local structures. And so when I first started practicing, I would have people come in and go, oh, I've got back pain. I go, okay, great. And we do an intake form and we do assessments and then we go through the treatment and training protocol. But my idea was to focus mainly on the low back and what the instructions around the low back to get them results. So we do the treatment, they come back, I say, how do you feel? They go, oh, I feel more mobile, more thing, but I still got this pain in my lower back. I go, well, can you point to it to me? And then they would point to here. That's your pelvis and your SI joint. That is your lower back. That is your hip area. You can tell because your ilium at the top of it, if you go across your body, that's L4. Right below it's L5. So from here to bottom of your rib cage is your lower back. I want you to get an understanding on where this stuff is coming from and the different pains and maladies you might feel and the issues that might cause that, so you have a better assessment so you can do something about it. Your lower back or your lumbar has a lot of different areas that could cause you pain. You could have some issues at your disc, you have some issues at your facet joints, issues at your lumbar plexus, or an issue at your ascending lumbar vein. All these areas could cause pain and dysfunction in your body. For the disc, you could have some sort of compression of the disc. Unfortunately, the disc, you don't feel pain until the very end. So by the time you feel pain, you more than likely have some sort of bulge, herniation, or prolapse, and of course some lovely arthritis to go along with it. Those discs, when compressed, can touch the peripheral nerve, and they can cause referred pain or localized pain. So you can have something like sciatic pain, or it could hurt at the joint. The facet joints are like the steering wheel of your vertebrae. The facet joints are a complete joint with the synovial and the capsule. The facet joints touch, like all structures in your body. If they touch, they start to have what's called the Delpech law, which means the more I rub, the more I get anarchic production, like if I like calluses on my hand. But I get that internally, and that causes bad movement at the joints, but also cause pain in that facet joint. Your lumbar plexus can be affected by the first two. So the lumbar plexus, a bunch of nerves that go out, and if I have some sort of dysfunction at the disc, the facet joints, causing dysfunction in my lumbar spine, it could possibly touch one of those nerves and doesn't feel too good. The ascending lumbar vein will cause like a bar on your back. So what if you have a big gigantic bar across your back, like I can't move? It could be from the ascending lumbar vein. The ascending lumbar vein goes through the two parts of your psoas, and the fascia associated with it goes right through. So if it's through those two areas, and that fascia of the psoas, iliopsoas, or the actual iliopsoas is too tight, too immobile, and compresses it, you compress the artery, which causes pain in your lower back. Pain in your hip can be caused from some sort of bursitis in the hip, some sort of issue at the capsule, a problem with vascularization of the hip, or the muscles that attach your pelvis to your hip being too dysfunctional, tight or weak, causing improper mechanics of the hip. For bursitis, it's an inflammation of the bursa. Bursa are fluid-filled sacs that are in your body. Like all soft tissue, if it's supposed to be hydrated, it needs to be hydrated. And so the bursa, when they're hydrated, is like a nice cushy sponge. When it's not, it's like a little rock. So now you have a dehydrated little rock inside your body. It's like a little rock in your shoe. When you move around, it doesn't feel good and causes inflammation. The hip capsule has your iliofemoral, ischiofemoral in the back, and pubifemoral ligaments. They need to work properly. There's a ligament around them called your Weber ligament that also helps to allow these ligaments to work properly. But if your ligaments are dehydrated, don't work properly, are unintelligent because there's no proprioceptive quality, then you're going to have hip pain because your hip is not moving the way it should, and you get weird mechanics. For the vascularization, you have arteries that want to go into your hip to vascularize it, to bring nutrition, to take away waste. If you have some sort of issue for vascularization, your hip will slowly necrose, slowly die. You won't feel pain at the beginning, but you'll start to feel pain later on because it's dying. So the sooner you get to that, the quicker it goes away. Because if it goes all the way dead, obviously it's dead. You got to chop it off and put a new hip in there. So a little quick pro tip. If you're a scuba diver and all of a sudden you're starting to slowly have hip pain, that's that vascularization. You could have come up too quick. Now the arteries aren't working properly to go down into your hip. So go see somebody as quick as possible to take care of that. But the most common one I've seen is a dysfunction at the muscles at the hip, namely your pelvic trochanter muscles. They're too tight and pull your hip in place. So we call them your pelvic trochanter muscles, mainly your obturator internus, piriformis, Gemini, and your quadratus femoris. I had to think there for a second. But their job is to coapt, to pull your hip in, to bring it together. But if they're too tight and too stupid and too weak, now that coaptation becomes rubbing. That rubbing now starts to wear away the cartilage at the head of your femur. At a certain point, that cartilage being worn away hurts. Ask anybody who's had a hip replacement how they felt before. It doesn't feel good. So those are the causes of hip pain. And now the SI joint. So we save the best for last. Because dysfunction at your SI joint, of course, will cause pain at the SI joint. But it can also cause pain in your hip and your lower back because of the connections. Your SI joint is comprised of your ilium and your sacrum and then joint in between. You have a lesser arm part of it, that's the top part. You have a greater arm portion at the bottom. You have an isthmus in the middle. And so the SI joint is a total joint, like the facet. There's a synovial, there's a capsule, there's proprioceptive quality, and there is movement. It's not huge movement, like moving your arm, but there's micro movement. And that micro movement is very important to the health of not just your SI joint, low back, and hip, but to your whole body. Because as I move around, my pelvis is a connecting link between my upper half and lower half. And so if I have force going through my body, down and above, that force goes through my pelvis and namely the SI joint. If the SI joint doesn't move how it's supposed to, then I get dysfunction. Where? Who knows? You can have pain in a lot of different areas from the SI joint. I was just treating a lady just recently. She came in with knee pain. We started to test and treat her SI joint, and I touched her like you would touch a baby's forehead. And she jumped out because she was so inflamed and so intense. So she had problems at her SI joint, but it also caused knee pain. At that SI joint, you also have very important structures that if dysfunction can cause pain and further dysfunction in the rest of your body. You have your anterior and posterior sacroiliac ligaments. You have your sacral plexus. You have your iliolumbar ligament. You have the connection to the hip. This is a very important area to keep balanced. If you're looking to find a program that helps you to get out of pain, get more mobile, increase your awareness and your posture, then let us help you. We've got a link in the description below so we can have a diagnostic consultation. You simply click the link, put your information, choose a time that works best for you, and we get on a call. We'll unpack your whole situation, where you are, where you want to go. We'll give you some good helpful information, and we'll show you how we can help. If you're not ready for a call just yet, then we have a free resource for you on how to sustainably train your body. So again, in the description, you click the link, put your information in, and you get instant access. Once you do one or both of those, then I want you to stay tuned for this next video on the secret on how to cure sciatic pain. Please subscribe, and then don't forget to like and share this so that others who are looking for this helpful information can see it. And please remember, it's not just working out, it's building a foundation for a better life.